Welcome to The Go, a podcast that explores more about faith, health, sports, as well as human interest stories. Today's topic is all about fistula. In the studio, I'm not alone. I'm with a guest who will explain herself. Welcome.
Thank you. My name is Marriam Twaya. I am a nurse here at Mlambe Hospital, Lunzu Blantyre.
Okay, as I have already said to our listeners that today's topic is all about exploring more on fistula. To you as a nurse, what is fistula and how does it occur?
Fistula is an abnormal connection between two body organs or vessels. It often occurs resulting from an injury, maybe an infection, or surgical complications. Fistula, when we mean that it is an abnormal connection between two body organs or vessels, it's an abnormal condition that happens between two organs. For example, we have anal fistula. So this is an abnormal condition where a rectum has a complication between the skin and the rectum. You see? So when we are talking about fistula, it's just an abnormal connection between two body organs that is resulting from an injury or an infection or surgical complications. So there are many types of fistula that are here, and I think I will explain in deep.
Okay, fine. What are some of the types of fistula and how does they differ?
Okay, first of all, we have obstetric fistula. This is a type of fistula that results from prolonged labor. You know, we as women, it is just a tough time during the labor. You know, you are pregnant and it's time for you to give birth. This type of fistula mainly occurs when you are pregnant and you want to give birth naturally. In some cases, it might happen that you are giving birth and there is a passage through your vagina. So it's like that passage. It expands when the baby is coming out, and then after the baby that has come out, you have the baby now. But you as a woman, there is a gap that is connected. That is there. That is just open, and it's like you see. So that space, that's an complication. Yeah, that is not normal, but it's a complication between two body organs, between your vagina and the pelvis. And so we have another one, traumatic fistula. This is a type of fistula that is caused by injury or violence. So maybe other listeners can be like, maybe what do I mean? This type of fistula, for example, maybe ladies are praying. You know, ladies have different kinds of praise. For example, maybe they are praying somewhere, like maybe there is some wood, like mitengo. They are maybe climbing the tree, for example. So one is climbing a tree, and then accidentally he or she hits herself direct maybe to the genital part. You see? Yeah, the tree has crushed the person to her genital part. So this is a type of traumatic fistula that is caused by an injury or virus. Or maybe you are fighting with someone and then accidentally the person hits you. So maybe the hit was just too much, and then you find yourself that I'm hurt. That is also another kind of fistula. You feel the pain, and maybe other people don't know what has happened, but that's a type of fistula that is caused by violence or you can say injury. And then there is a latogenic fistula that is resulting from medical procedures or surgery. For example, someone maybe has a problem, like maybe you can say we want to do the surgery, but then it needs one maybe to be, this is the stomach, we need to cut, maybe to remove something, maybe a stone or whatever. So this type of fistula is when maybe accidentally, we as doctors, nurses here, it can happen accidentally. That is accidental, right? It's not our fault. Of course, maybe other people can blame like that, but it's not our fault. This happens accidentally. Like you are removing that thing, and then maybe there's a leakage on maybe between the intestines, and maybe you have, of course, maybe we're gonna put in like the kidney. So this is the type of fistula that occurs accidentally, but by the way of being good surgery. You see, so there are a lot of types of fistula, maybe including the anal fistula. I have already said at the beginning. There's also anal fistula. This is a type of fistula that is between your rectum, the anus. Now, we're talking about the anus and the skin. This is also a type of fistula. Maybe that is common. Maybe other people know. So that is also another type of fistula.
Okay, fine. What are some of the symptoms and complications associated with the fistula?
All right. Fistula is associated with many of the symptoms. So, our listeners, maybe if you can recognize these signs or the symptoms, please visit the hospital. First of all, maybe you can have the uncontrolled urine. Okay, one can feel like, I want to urinate, but then you just think that I want to urinate. Looking at yourself, you have already urinated on yourself, you see. So that is that is also another sign that you are affected by the fistula, but you don't know. You just see, maybe you can just think like, maybe the urine was just too much, but no, that is a fistula symptom. And another one is fecal leakage. Like, okay, you want to going to visit the toilet, and then you just feel like, let me go. The time you are saying that I want to go to the toilet, I want to visit the toilet, is when now you see or you feel yourself that I think something has already happened in my bag. You go to the toilet, but you realize that this is not normal. I have already you pull on yourself. You realize you recover that this is not normal, but it has already happened. You see. So another symptom of fistula you can recognize is pelvic pain. Pelvic pain, the pain maybe you can feel under your maybe I should say
waist or
the waist, under your abdomen, actually close to your vagina. That's another sign that you are suffering from fistula, but you don't know. So when you feel those signs, don't ignore them, but you should visit the hospital. And another symptom of fistula is it can be infertility. Maybe we're not saying that you cannot say that that did not give birth, they are suffering from fistula. No, but there are other cases that they infertility came because of fistula, but other people don't know. Fistula is you can say that it's a bad complication because there are other people who did not give birth till today because of fistula. So if you are not maybe you are married, of course, maybe years are passing, ask yourself, visit the hospital, and maybe go there for the checkup, and they can do other necessary treatments, or they can treat you. They can maybe you see. So if maybe you are married, years are passing, this is the hospital and explain. It can be some kinds of the fistula I have already mentioned that you are suffering from, and you don't know that also result in infertility. So when you don't have any kid, but years are passing, I can encourage you to visit the hospital to do the medical checkup. And also another thing that maybe you can regard as a symptom of fistula is emotional distress. What do I mean? Emotional distress. Like you are here, and maybe something bad happened to you, and you just feel like you ignore the case, like it's normal, it happens. But then the thing is very important for you, maybe to be involved in that, but you emotionally distress it. You don't take it seriously. You just be like let it go. But looking the way forward, or looking the way that you could have solved it, and you have maybe made something important, but just you distress. You just say, let it go, I don't want this, but it was something important that you could have managed. And other complications like skin irritation and infection. Maybe your body now can change. Maybe you can have some lashes, just abnormal lashes, like is this one, maybe this morning what is this? Maybe you are feeling irritating, that's also another complication. And of course, maybe You can also have another complication like maybe mental health issues. Yeah, like you can test maybe some mental health issues like maybe disorders. Let me say disorders to engender those, because there are a lot of disorders. And maybe you can have your relatives. You just be mad about it, but then what they are doing is like they may be like madness, something like that. Take them and escort them to the hospital. That can be another sign of fistula. Yeah, that's what I can explain.
Okay, fine. Sometimes there are other women that give birth like every year, up to 7 children.
Yeah.
How does prolonged obstructed labor contribute to I think it's obstetric fistula development?
Yeah. Okay, prolonged labor causes tissue compression. So if you are saying that, okay, there are other, of course, yeah, women every year they want to have a baby. You see, every year having a baby, that's okay. For health issues, that's not health. We can advise them like that. That is not health, because when a woman is giving birth, her and her husband have to sit down and discuss. You want to have what kids do we need? Like four kids, like 10 kids. Have the space, because when everybody is giving birth, we encourage the mothers to stay for 3 to 4 years at least, so that the body can recover from the injuries of the labor, and the body can make its own blood. You see, so if a woman is giving birth every year, that is a complication that is leading to obstetric fistula, because the blood flow is reduced. Like every year the person is giving birth, she's not letting her body to make other blood cells. You see, so it's like the blood level is just the same. The body is not making another blood, so the baby needs the blood. She needs the blood. During the labor she loses the blood. You see, so if the woman is giving birth every year, it's like she got the blood, and that blood sharing to the baby. After sharing the baby, when she's giving birth, another blood is lost. You see, so it's like you have the blood, you are sharing it, and of course during the labor you are losing the blood. So this obstetric fistula is resulted from the giving birth. You see, so if the woman is giving birth annually, this means she is prone to have this obstetric fistula. So this creates a hole between the vagina and the blood or the rectum. This woman that gives birth every year,
like the tissues now are being compression.
Yes, they are expanded. So that woman has a hole. You see, I think other women, they are able to tolerate this. Or I can say those matured, or maybe girls nowadays, because things are just like everybody maybe can know everything. So yeah, I think our listeners are getting this. Like the person who's giving birth every year, having many kids regularly, that person has a hole resulting in obstetric fistula. Please visit the hospital. You are in need of a treatment, but you don't know.
Okay. As we are proceeding, what role does inadequate healthcare service and lay medical interventions play in fistula formation?
Inadequate healthcare services and delayed interventions, I can say that it increases the risk of prolonged labor and leading to fistula development. Like, okay, maybe let me say that there are other people, maybe let's say that like tribes, they don't believe like I should give the birth at the hospital. They delay it on their own, not the healthcare. They not saying to them like we don't have the enough resources to use for you. You see, they just delay on themselves. So if like a tribe, I know you get what I'm saying.
Yeah.
Like a tribe, they just believe like we can give birth on ourselves. Like maybe we go or we build something like we'll give birth at our church. There are other churches who allow this. And maybe I should not say it because it would be like maybe in one year, but it's not like that. But they should get educated. They allow their women to give birth at home. They don't visit the hospital. So it's like they take other women from the church or from their tribe. They just say that you just come here, help my wife, you see that thing. So they just help that the baby should come out without following the medical procedures, because they don't know that these people are not educated enough to give birth to someone, to help someone to give birth, you see. So they just take this woman help my wife. So now the wife is giving birth, but those people helping her, they don't know what to follow. They just, maybe the wife is pushing the baby and they just hold the head and pull it out, like, yeah, because the baby is born. But what us as medical doctor, medical nurses do after the person is giving birth, they don't know. They just help the person. These tribes, they just help the person, and in return they don't give any maybe meditation. Like here in the hospital, we can give a drip. Muntu we see that what is magazambiri, let's put another drip of blood, you see. So, but by the way, these tribes, they just allow the person to give birth, and they don't do anything in return, and they don't help the person, you see. So this one is like inadequate healthcare service, but during their in their community. And now, if maybe a person has visited the hospital now, maybe it's like we should say that it's already medical interventions. Like, okay, here I want to mean that a pregnant woman has come to the hospital. Like, we have given her maybe the medicine after she has given birth, but on herself she is drained. As the doctors, we know that this medicine will help her. You make her to be maybe to feel flexible. Yeah, like maunza mina nawaja azipola, but she don't know, she ignored it. Maybe with the help from their family members, they said, leave it. You have given birth and this is all done. Nothing important here. You see, the person is now draining the healthcare service. They are like, no, so they just say that what for the medicines? What for? Afuna aripi, nurses and doctors, they are not, maybe, sorry for use this word, but they are not stupid. Because those people, we are trained enough, we know the good treatment that we should give the person for her safety, So inadequate health service, healthcare service, and delayed medical intervention, it increases the spread or the complication of fistula, because what you go for is not what medications regard or is maybe you should do, So it's good maybe to not to delay this. Please go to the hospital and you should be helped.
Okay, fine. In terms of I think it's the use of Caesar, the cesarean section. How can cesarean section prevent the obstetric fistula, and how do socio-economic factor contribute to fistula development?
Okay, let me start with the cesarean section. Yes, cesarean section, like this method, like you have not given birth naturally, but you have cutted your, maybe let me just use the word, your stomach, and remove the baby first. This one can prevent obstetric fistula, because but it reduces the risk of prolonged labor. Like the way, okay, you don't feel the natural labor pain. It's just the pain you feel is just that you have cut your skin and removed the baby.
Yeah.
So you are not prone to suffer from obstetric fistula. Yeah, that's true. And the cesarean section is another way that maybe many women can prevent from the fistula. You see?
Okay.
Yeah, but I'm not encouraging that. It's just the time you want to give birth, you give birth, then go to the hospital and you are telling the doctors like, doing the Caesar, I don't want this. No, because other people, they are okay. They are like breast. I may say so. Like they just give birth naturally, no any complication comes after. They are just like, you just give the treatment for 3 days and they are just okay. So cesarean section, can prevent this obstetric fistula. And socio-economic factors can also contribute to fistula development. For example, like poverty. You see, there are other people maybe like they come from the villages. They cannot they cannot afford like to visit the hospital during the time that they want to give birth. So poverty can be another thing, maybe contributing to fistula development in the country. I can say so, because like we find that they are in the village. They don't have any money that they can use for transport to go to the hospital and receive the medical support. So poverty is another thing that is leading to that is contributing to the development of fistula. Of course, there's also another thing that is lack of education. Despite the poverty, lack of education, people are not educated. They don't know what to do. So they are like, we give birth naturally, we stay home by the help of our grandmothers. You see, people talk, of course. People talk, they don't know anything because there's lack of education. They don't know what to do during the time they want to give birth. There is also limited healthcare access. What do I mean by limited healthcare access? Like for example, there's a village, there's just one hospital, but many people. You see, so there's a time maybe they can say like, maybe as my they are not able to have or to access the medical care. You see, so maybe we should say that our country also needs many medical health care services that should be promoted in the villages so that everyone can access, so that like these socio-economic factors should not be one of the things contributing to fistula development. And of course, but there's also early marriage and childbearing. Maybe let's focus on the early marriage. Early marriage is another thing, you know. For example, nowadays girls are
at the age of 13.
Yes, they are giving birth age 12, 13, 14. These are the kids. We may say so, and our country law say that they are kids, even below the age of 18. They are children. You see? So yeah, you are a kid, you are giving birth at 13. What are you expecting for your health? This is a problem, and this is a complication you are causing to yourself. If you don't know, advise your relatives, your communities, advise them. Have something to do. Imagine a 13-year-old girl is just a small kid, a 13-year, just a teenager, a new teenager is pregnant and is planning to give birth. The genital part is just too small for the baby to pass out. You see, so it's like there's a lot of pressure that is needed for the baby to come out. So we are forcing it to maybe to what allow the baby to come out. The genital part is just too small. There's like what a contrast. Of course, the virgin is like a laba. But that is just a small baby, you see. So I'm going to do
To reach up 15 centimeters, I think so.
Yeah, so that's another challenge. Early marriages that is leading a lot to develop fistula in our country.
Okay, what strategies can be used to prevent the obstetric fistula? As you have explained that it's all about the anus and rectum.
Okay, first of all, let's start with family planning. Family planning is very important, though other people deny it and take it as something not important, but family planning is very important thing to consider. For example, if you want to have 4 kids, plan. Give birth today, have 4 years or 3 years forward. Then you should give birth again, not every year. Yes. They should arrange the pills. You got many ways. And it's normal. Choose the best way that suits you with your body. So kulera kujja kuzitaniza kuti chirido mene nongone zoti complication mene ya fistula ijepa chifukwa chokuti like you are allowing your genital part to relax, allowing it to recover from the injuries it has during the another birth, you see. So another thing is timely cesarean section. Okay, for those people who give birth through the cesarean, so it should be that when they know that it's 9 months, they should visit the hospital in a good time. Like they should be operated in a good time. Miezi 72 abo chipatala ande chithandizo
kuli nthawi ija mazafika sinanga mwana azafuna so
kutuluka. So anthu onse, I encourage all women that give birth through the Caesar that during the 9th month they should visit the hospital They should not ignore the signs, but visit the hospital and being operated. That will also help a lot, maybe to prevent this obstetric fistula. And also, in addition, improved healthcare access. Like I have already said that healthcare service is very important to visit, to access it. So every woman who is pregnant, please visit the hospital. You'll be screened, you know your healthcare, that I'm alright, and this is very important thing to secure. Yeah.
Okay, fine. What are the surgical and non-surgical treatment options for fistula repair?
There is surgical repair. Like, okay, the person, we have discussed that is obstetric, like for example obstetric fistula, like, or the hand fistula, but let me focus on the obstetric fistula. Okay, we do the surgery. Okay, pamene panali bala paja ngati paphwasuka, we say timapanga surgery timasoka apo, you see. So time by time pakati pakuchira, cause munthu chisidwanga musenje kuti amusoka but musiye. No, we give the treatment. The person needs the treatment, you see. And if the person is married, we talk to the family, or let me say the husband, amusiye kenzi mayuja bala lija lipole buno bwino asana panga ina chichonse andikire. The woman should recover from that injury, you see. So timapanga surgery, munthu uja azitolere akhale bwino. And of course also there is a non-surgical method, like we use the timakusenjero mankhwala mpasa munthu uja okuthandiza kuti okay timambakereza mtundu wa magazi a munthu uyo. Is it because magazi amagwira so ntchito mosiyana imene mabala munthu kanibala zimasiyana. So timaona kai munthu uja timezeke mankhwala tuoneka kuti munthu uyu timezeke magazi, kuti munthu uyu ni magazi ake nangwira ntchito, magazi ake mphamvu ya magazi ake tikampasa mankhwala achira kamene uya kufunika operation, timaona kai zinthu zija differentiate. So tikonzeri magazi a munthu uja namphamvu, for example it's mainly we just give the medicines, like there is catheterization. This is the type of medicine that we give the person, or we even give a fibrin glue, you see, the glue, stick that the like the body organ, or like where there was a torn, it's just getting back to its physical, it's normal now.
Okay, fine. What would be your comment on this topic today about fistula? That I think out there listeners are there, they have learned more about fistula. What would be your comment on this topic?
Okay, maybe I should say maybe last year I will comment on fistula. That fistula is something that we can prevent. It's preventable. Everyone can prevent it. Okay, just follow the measures that we have explained inside this podcast, because there are a lot of things that we have discussed. First of all, families, women's, use family planning methods. Discuss with your husband. Have reliable family methods. Don't have like you should be bearing kids every year. No, you see. And also, if you know that you give birth through the Caesar, when it's your time to give birth, visit the hospital during the 9 months. Because this is the good time and this is the time I'm giving birth. So visit the hospital. Don't ignore the signs, but visit the hospital. Talk to your doctor. They know, they will palliate you in good time, and no other bad effects that can come because of that. No, because there's a good treatment that is given out. And for those people like who are engaging in early marriages, please avoid early marriages, because when you are forcing your body like to bear children at an early stage, this is another way that is blown.
That will contribute.
To a complication called fistula. So please prevent early marriages, and for married people, please encourage to be using the family planning methods. Muzirela. That's all I can say.
Thanks for your time. This marks the end of our podcast today, titled Fistula. You are with your host, Faith Imalola.